Welcome to Physician Focus. I'm Dr. John Fromson. Each of us at some time in our lives will lose a loved one and subsequently experience the mourning and bereavement that accompanies the death of someone close to us. After a period of sorrow, perhaps even guilt or anger, most people begin to accept the loss and move forward with their lives. For some, however, the grief and feeling of loss become more severe and lead to what we call complicated grief, a potentially debilitating condition. This edition of Physician Focus will examine the topic of complicated grief, its symptoms, causes, risk factors, and what help is available for those affected. Joining me for this discussion is Dr. Naomi Simon, a board-certified psychiatrist. Dr. Simon is the director of the Complicated Grief Program and director of the Center for Anxiety and Traumatic Stress-Related Disorders at Massachusetts General Hospital in Boston and an associate professor at Harvard Medical School. Dr. Simon is also the Chief Medical Officer for the Home Base Program, a joint program of the Boston Red Sox Foundation and Massachusetts General Hospital that provides clinical care and support services to Iraq and Afghanistan veterans and their families throughout New England who are affected by combat-related stress or traumatic brain injury. The program also offers clinical and community education about the invisible wounds of war and the challenges faced by military families. Welcome, Dr. Simon.
Thank you.
It's really great to have you here. And this topic is something that potentially can affect us all, but it's difficult to talk about, but I think our viewers will really appreciate this. Maybe we can begin by just briefly reviewing what exactly is complicated grief.
Sure. Thank you, Dr. Fromson. Many people do get confused by what we mean by complicated grief because, as you mentioned, all of us in our lifetimes are exposed to loss, and loss is one of the most stressful things that we experience in our lifetime. So grief is basically a universal phenomenon that everyone experiences, but complicated grief occurs just in a small proportion of people. So about 3% is the prevalence rate, but about 7% of everyone who is bereaved, who's had a significant loss of an important person in their life. And so complicated grief really can be thought of in the way that we think about medical complications, that there's a complication that interferes with grief progressing along the usual pathway. Now, there's no single way to grieve at all. Everyone grieves in their own ways, and in some way we grieve forever because we can never bring our loved one back. And that's one of the things that's really different about loss and grief than other types of stressful experiences like a trauma, where the trauma is over, the loss is permanent. So in usual forms of grief, people will have a period. It varies. It can be anything from days, weeks, months, where there's a very intensive period of what we call acute grief. But that type of grief will evolve over time, and people will adjust. Even though the loss is still present and there'll always be some sadness and so forth, it moves from being really front and foremost to being more integrated into one's life so that you can move forward after kind of accepting the sadness of the loss and finding a place for oneself in the world without your loved one present.
Sure, I know you've actually taught me, a nice metaphor in terms of, waves crashing into a beach, and certainly initially the frequency of those waves and their force are pretty intense. But as you're suggesting and sharing with us, Dr. Simon, it seems like over time those experiences will decrease in intensity, and also they'll be further apart.
That's right. So, it would be very, very common always to have some increase in that intensity at a very important date, like the anniversary of the death, or a birthday, or maybe if it's a spouse, the anniversary date of the marriage and so forth, and that you would see some ebb and flow, but that after maybe 6 or 12 months or so, and again, these vary quite a bit by person, and where we should set the mark for complicated grief has been somewhat of an area of debate, with current in our DSM-5 has selected 12 months. But over that period of time, usually what we see is more of that ebb and flow, less of a constant crashing, if you will, and more of a lower grade sort of coming mind going, but an ability to really put it aside and do other things so that your entire day, week, and focus is not only on the death and the loss. That is more the case in complicated grief, where we think there's some complication that interferes with kind of integrating that loss or adjusting to that loss, accepting it in a way that allows a person to reconnect with other people and other activities in their lives and move forward.
So a hallmark of complicated grief as opposed to regular grief is that it goes on, the grieving goes on for longer than a year, and it has a direct impact on somebody's functioning, whether it's at work, whether it's at school, if they're at school age, or whether their relationships are impaired or their community involvement. So
exactly. So there can be really a much more front and forward, persistent longing, distress about the loss, and sometimes the focus is around the circumstances of the death itself. And particularly this can occur for people who were caregivers or who either were a parent who lost a child or a spouse who had been taking care of a loved one and so forth, where they begin to focus too much on thinking that they have responsibility for the loss. So we call that caregiver self-blame. And that people can spend a lot of time really just focusing on the what ifs. So if only I had, called the doctor a day earlier or encouraged my loved one, harder not to smoke, and they wouldn't have got lung cancer or something like this, where they really take on the blame in a way that cycles and makes them feel much worse and is beyond the facts. So sometimes people will need help to be able to move forward past that kind of thinking.
Sure. And if there's been a tragic loss has taken place and a year goes by and ability to function is impaired, how is that different from, let's say, somebody having a major depression or major depressive illness?
Yeah.
Because sometimes those symptoms can be very similar.
Yeah, and it really can be quite confusing because both things can be present. In fact, we did some work showing that about half of people may have both depression and complicated grief who have been suffering for usually years with complicated grief. But they can also be distinguished because in major depression, what we're talking about is a really pervasive and persistent sadness and loss of interest in things that is not specific to the loss of a loved one, whereas the focus is really the sadness about the loss itself, the longing for the person, and the focus on distress around the death itself, and the moments of the death may even be a focus of rumination. There are other overlaps, though, because both can lead a person to feel quite hopeless or like there really is not a life for them at this particular time, although in complicated grief, it's much more connected to thoughts like there's no point living without my loved one and moving forward. But even in looking at some of the differentiation, like with feelings of guilt, you may have some guilt in depression, but it's a more generalized, not guilt around the person and the relationship and the death itself.
Very, very helpful. So we've identified complicated grief. We've talked about that versus the normal grieving process. We've also talked about depression. And how about something that we've heard so much about in terms of post-traumatic stress?
Yes.
Certainly with the things that have been happening, in terms of the Boston Marathon and other major events, and people returning from our wounded warriors coming back from Iraq and Afghanistan with post-traumatic stress. How is that seen as different? Because certainly that happens many months after an initial event.
Yeah, absolutely. Well, post-traumatic stress disorder, for one, can be actually diagnosed within a month after a trauma. So that is one thing that's different, although it can, as you were mentioning, last as well, chronically for years. But a loss in and of itself can be thought of as a trauma. It is, it's a separation trauma So we think that in complicated grief, there's a attachment distress. So you have a very close attachment with someone, and that's a trauma. But it's very different from a trauma like you are in danger and you're not safe. So in post-traumatic stress disorder, it's really much more of a fear-based condition. So people may relive that trauma over and over and really feel like they still are not safe, and reminders make them feel unsafe. And a lot of the work that we do in post-traumatic stress disorder is to help people to relearn safety and to really extinguish that fear that they developed about a specific situation. In complicated grief, it's much more of the separation distress, almost like a separation anxiety type of distress. I do like to think of it as a post-loss stress disorder, though, because really similarly to trauma and post-traumatic stress, really death is one of the most traumatic experiences that a person can undergo, but it's an attachment trauma, a separation from a loved one. And in complicated grief, there is that need to adjust in many ways to a life that has changed. That might be true in post-traumatic stress disorder, but again, it's not about a relationship. It's not about an adjustment without a loved one in that same way that trauma is really about fear and safety.
Sure. I think most mental health professionals are pretty familiar with complicated grief, but for the benefit of our audience, how did this diagnosis come to be? And how recognized is it right now?
Yeah. Well, even the term complicated grief has been somewhat under debate if that is the best term for this condition. But really, for years and years in our psychology and psychiatry literature, people have talked about difficulties with grief under different types of names, like pathological grief. We don't really like to use that term because it sort of blames the person, which is clearly not what's going on if somebody is continuing to suffer. Some people have used the term traumatic grief for the reasons we really talked about, although I think that can be confusing because any kind of loss really can cause complicated grief. Others have used persistent grief, and actually just in the past month, our psychiatry diagnostic system, the DSM-5, the next version of that diagnostic system just came out, and they've included in what they call Section 3, so new diagnoses, for which we're still researching and agreeing together on the very best way to both name it and to make the criteria for it. It came out as persistent complex bereavement disorder, which is a bit hard for some of us to say, but really it's that exact same concept of complicated grief.
You mentioned earlier, too, you used the word prevalence, and again, for the benefit of our viewers, prevalence is the number of cases of a specific problem like this, like complicated grief, seen over a period of time. And I wanted to ask, your expertise more about that in terms of its overall prevalence in the community, and whether you're a clinician, a family member, a loved one. If somebody is experiencing grief for a particularly long period of time, what are the chances of that happening? How prevalent is it in the community right now?
Well, amongst our best studies, which are what we call epidemiologic studies, where we go out and talk to a lot of people who have had a loss and really do a careful assessment to see if they do have these kinds of symptoms, they suggest that amongst people who have had the loss, 7 out of 100, so 7%, or 7 out of every 100 who are bereaved identify themselves as having a significant loss, will meet the current criteria for complicated grief, whereas the vast majority of people do not. And that is not to say that they don't suffer at all from their loss, but that they are able to, with a range of different types of supports and resources, move forward from that so it isn't such a prominent problem that it interferes, as you say, with functioning in their interferes with their ability to move forward in their lives or find meaning after the person dies. So that's our best number that we have so far, is about 7 out of 100, and that is just on average in a vast range of people. We do know that there are some risk factors that are going to make that number go up. So, for example, amongst people, you asked about depression, people who have been suffering from depression already when a loved one dies are going to be at significantly increased likelihood of struggling with that grief, which is being added on top of their depression. So problems with kind of mood or anxiety or problems that were present before with depression, anxiety disorders, post-traumatic stress, those can be things that will add complications, increasing the likelihood that someone may develop complicated grief. Some of our studies suggest actually that amongst people with either major depression or bipolar disorder, that the rates are likely around 25%. So 1 in 4 who have had a significant loss of a loved one and still have complicated grief symptoms, at least 6 months we used in that study. Later.
That's a very important contribution for us. I mean, that's really almost a 3 times increase from the general population. So an important thing to remember, those of us who have friends or loved ones that have had a significant depression or have bipolar or manic depressive disease, they may be really more at risk of developing a complicated grief if they incur or suffer a tragic loss.
That's exactly right, as well as people who have post-traumatic stress disorder or may have had other significant traumas earlier in life may be at elevated risk as well. And there might be some other types of things associated with the nature of the loss itself that may increase risk. So it's, as one might expect, one of the highest, most likely types of losses to cause complicated grief is the loss of a child. It's very, very difficult to deal with the loss of a child for anybody. We don't have exactly rates for that, but we do know that that is a risk factor. Also, if there are other types of issues going on at that time, for example, there's a lot of other life stressors that the person has to deal with and they're not able to attend to the loss and so forth, or say it occurs during a disaster or something like that. All of these things may contribute, and we're really just starting to, from a scientific point of view, break it out so that in the future we could give you numbers associated with this in the way we've started to do for depression or post-traumatic stress disorder.
Sure, that's very, very helpful. And how about, are there any differences between male and female, or young or old? Any patterns that have been discovered?
Well, we do know that we have had more women coming in for treatment overall, and it appears, as it is with anxiety disorders for the most part, that women may be at elevated risk, but it really can occur at any age and with both men and women. And even though I mentioned like the loss of a child as being particularly an increased risk, any type of close relationship that is important to a person, it doesn't have to be a traditional marriage or anything like that. Parent often is another type of situation that can lead to complicated grief, or a very close sibling, for example, can also lead to that. So there's nothing fully protective from developing this, but really it's probably the most common amongst women.
Sure, and certainly in the United States we have such a very diverse, culturally diverse population. Any differences there, or are all cultures equally affected by this?
Mm-hmm. Well, that's a really great question. I think one of the things about grief that is important is that we have so many cultural traditions. There's both cultural and religious traditions about how one copes with grief, and there are also family traditions. And for the most part, as I said, most people really are, even though they're sad about the loss, they're what we might call resilient to that. And many of our cultural traditions help us to be able to move forward from that acute, intensive grief to that more integrated grief. So, we respect those very highly. There's no particular religion or culture that will predict who will develop this condition, and it is being studied now internationally, so we will know more about these kinds of rates as we use the same terms and measurement of this. But really, when somebody has an acute loss, it's best to encourage them to use their supports. So reach out to their social supports, reach out to their network, be it their church or religion or the people who are close to them in their lives, their friends, to help them to get through this.
So after a loss, the take-home message here is try not to be alone. Make sure you use those connections that you have.
Yeah, because other types of complications and things that occur in complicated grief is when there's a lot of avoidance. So, for example, if a husband lost his wife and they did all their activities together, but now everything that he does reminds him of her. So he doesn't want to go golf anymore, he doesn't want to go to dinner with their friends, and he starts to stay home all of the time. That is going to increase the likelihood that he will develop difficulties over time. And so we call that avoidance related to the loss, or avoidance because it reminds him of his wife or the loss. So that's another thing that can be a complication and also a symptom. So that's another bottom line, is to, try not to avoid your usual activities and your supports.
That's very, very helpful. How about other symptoms in addition to avoidance and isolation, in terms of differentiating complicated grief from grief or depression or post-traumatic stress?
Yeah. Well, the most worrisome symptom, which can occur in any of these conditions, is actually hopelessness or feeling like life is not worth living. And this is the one where we would immediately suggest, if someone is thinking they want to end their life, that they should come talk to their doctor, go talk to a psychiatrist or their primary care doctor and seek help. So that would be another very important one. But really, I think the sort of feelings of separation, loss, longing. Sometimes people will find that what we call proximity seeking, which is a fancy way of saying trying to get back together through looking at pictures, spending all day at the grave site, or really only spending all of your time going through things that would prevent you from connecting in any way to life. And that's not to say that one shouldn't spend time, but really when grief is the only way that one can connect to the memories of their loved one, and that the activities around that, like staring at pictures or being at the cemetery all day, every day, interfere with connecting in any way with other people, then that is also often an issue for people. And if it causes significant distress and functioning, that's a place where we would be concerned about that. So there's that kind of mixture of the traumatic symptoms, the sadness, longing, the avoidance, and some of this proximity seeking that people may experience, all of which can lead in some more severe cases to that suicidal thinking.
Very, very helpful. And if someone thinks that they may have complicated grief, or a loved one or a friend, how do you get help for that? How can you simply go to your primary care physician, or are there special avenues that people can seek?
Yeah, well, there is really a fairly young literature and research on the best treatments, but many, many people are helpful around dealing with grief. So as I mentioned, going to your community supports may be a way to start, as well as your primary care doctor. There are also grief support groups that may be present in the community that people can join if they feel like they're having significant difficulties with grief. I think a big part of it is really speaking up to their primary care doctors or to any counselor or provider that they may be seeing about the symptoms that they may be having, and to really understand that complicated grief is a treatable condition. So really what our job in complicated grief work is to help people to move past those complications so that they can move forward into what we think of as that sort of more integrated grief state, so that they can put away the thoughts about the death, for example, and do other things. And that is really important, is to help people understand that grief isn't the only way that they can honor and respect and be connected to the loved one. If all of their thinking is about death and about the death itself, they may not even be able to remember some of the very positive memories that they had. So really the treatments that we can think about are, there's not a lot of research for it, but starting with your primary care doctor, going to grief support groups, and then the best evidence is for something called complicated grief therapy. And that, as you know, is something that we've been studying as well at Mass General Hospital as part of our study. But there's been another randomized controlled study by Dr. Catherine Shearer, who developed it, which showed that she had twice as much response compared to even another specialized psychotherapy called interpersonal therapy. And in this therapy, it's really quite unique because it focuses in two directions, both on that processing of the loss itself, but also on decreasing that avoidance and reconnecting, finding goals and meaning in life without their loved one. And then finally, there's a very small amount of data suggesting that antidepressants might be helpful. And this particularly would be the case, certainly, if there is another condition present, like major depressive disorder. So again, it's very good to go to your primary care doctor and talk to them about these issues.
Well, Dr. Naomi Simon, it's been really a privilege to talk about this subject with you. And thank you so much for sharing your knowledge and experience and research findings with respect to both the identification and the treatment. We really appreciate it. And for more information about complicated grief, visit the websites listed below at the end of our show, and to view past physician-focused programs covering a variety of healthcare topics, visit our website at physicianfocus.org. I'm Dr. John Fromson, and for all of us at Physician Focus, and on behalf of Dr. Naomi Simon, thank you so much for watching. I'm Dr. Naomi Simon. The loss of a loved one affects each of us deeply and in different ways. While grief does not have a timeline and there's no single way to grieve, most of us will successfully adapt to our loss after a period of mourning. Some people, however, develop complicated grief, a clinically significant condition marked by symptoms such as severe and persistent grief, intense longing for the deceased, preoccupation with or trouble accepting the death, difficulty returning to shared activities, and a lost sense of purpose. Complicated grief can increase the risk of physical and mental illness, substance abuse, and suicide, and can interfere with the return to a satisfying life. If you are feeling persistent, intense grief over a loss, see your healthcare provider. Treatments can help this condition. For more information about a program at Massachusetts General Hospital studying the treatment of complicated grief, visit bostongrief.com.
I'm Dr. Mary Elise Manuel.
I'm Dr. Paul Bittinger.
The bombings that occurred at the recent Boston Marathon are the latest example that disasters, whether natural or man-made, can happen at any time with little or no warning.
The response to that crisis also demonstrated how critical preparation and training are when responding to an emergency. The actions of trained medical personnel and first responders minimize death and injuries.
The bombings also showed the importance of citizen participation in assisting in emergencies, with the quick actions of marathon spectators and public tending to those wounded.
As disaster medicine specialists, we believe that it's vital that everyone learn the basics of how to prepare for disasters and what steps to take when one occurs.
To learn how you can make a plan and prepare for such incidents, visit ready.gov.
And we encourage you to volunteer as part of an emergency response team. Visit MA Responds to learn how.